Good morning, everyone. We welcome you on this Monday morning, glorious Monday morning. We have a very esteemed uh, guest with us today, Dr. Gaurav Agarwal. He is the professor of endocrine and breast surgery at SGPGI, um, professor of endocrine and breast surgery and convener of SGPGI breast health program. He is also the Chief Medical Superintendent as SGPGIMS Lucknow, and he's the President of Breast Surgery International. He is a trained, experienced endocrine and breast surgeon specializing in minimally invasive thyroid, parathyroid, adrenal surgery. It's comprehensive breast cancer management using breast conservation surgery, sentinel lymph node biopsy. He is widely regarded as the opinion leader in the field of breast oncology, parathyroid surgery, sorry, I'm not being able to pronounce his name, so I'm going to skip this. I'm sure Dr. Gaurav Agarwal will take this on during his conversation. We currently are seeing breast cancer and cancer being one of the leading causes, and breast cancer among all the cancer deaths is the third leading cause of deaths in worldwide. And we've realized over the years worldwide that bringing awareness to people is of paramount importance. And that can prevent a lot of deaths and a lot of misery among these patients. If it's early, if it's detected early, it can be cured. And there are many cases of survivors today everywhere. There are at least a few million survivors who have their stories, and cancer early detection of this disease has been pivotal in their success, in their recovery. I would like to invite Dr. Garwal to go ahead and start his conversation. Thank you, Dr. Agarwal, for being with us today and taking time out from a very, very busy schedule.
Thank you, Anita, for that kind introduction and um, um, rather liberal praise that you have bestowed on me. What's important, perhaps, for me, for my audience to know, is that I am a early breast cancer detection crusader. One of my motto or motive in life is to encourage women to be breast aware and be able to detect any breast problems at an earliest possible stage so that that can be cured, and it doesn't affect their lifespan, it doesn't affect the quality of life of these women. So it's very befitting that Lucknow Farmer Market has asked me to speak to this audience about breast awareness and early detection of breast cancer. These are indeed the key to taming this beast of breast cancer. As very rightly said by Neeta, cancers are on the rise. Breast cancer is the commonest cancer which affects women all across the globe, as also in our country. And it's important that we do something about preventing it, and certainly preventing cancer related deaths, premature deaths in our society, and the suffering that the disease can bring. So, as has been introduced by Neeta, and as I said earlier, the first step to taming this beast is to be aware of breast cancer, which is a common disease, and various other issues relating this disease. And this is precisely what I'm going to do. We're just a few days out of October, which is observed as the Breast Cancer Awareness Month globally. The Pink Ribbon campaign or movement, which started in sometime in 1960s in some Western countries, which has steadily spread across the globe. and it's in continuation of the same that we wish to encourage women to be breast aware and do something to detect breast cancers at an early stage. So the whole discussion today would be about breast cancer awareness and early diagnosis coupled with comprehensive treatment can save lives and can save breasts. If you just allow me to help you with understanding these aspects of our discussion, I'm sure at the end of this, you will be convinced that indeed breast cancer awareness and early detection and comprehensive treatment can save lives and breasts. Few facts about breast cancer in our country. It is the commonest cancer affecting women in our whole country. It used to be the second commonest in rural women until a few years ago, a few decades ago. And the cancer of the uterine cervix used to be the commonest one, but no longer so. It has overtaken, uh, reducing the incidence of cancer of the cervix is a success story for public health scenario of our system of our country. But unfortunately, breast cancer incidence is only increasing. Breast cancer currently accounts for approximately 30% of all cancers that afflict women in our country. And sadly, it is also the cause for more than 50% of all cancer related deaths in the women in our country. Another rather discomforting fact is that more than 50% of women with breast cancer in our country are diagnosed at a rather early age. Uh, Unlike Western countries, where breast cancer is known to be a disease primarily of elderly, aging women, postmenopausal women, in our country, almost 50% of women are diagnosed in the age group between 25 and 50. Well, I can't say, or I would dare not say that any lives are expendable or any age it is okay for a woman to die. Certainly not. But younger women, women in prime of their lives, more productive age groups are certainly more precious part of our society. If something happens to them at this age, the family gets distraught, the society is harmed, and the country is harmed as well. So, this is certainly not such a good fact about breast cancer in India. Well, breast cancer can well be detected in early stages, at stages when it is readily treatable and curable. How do we do that? It can be done by making our society, the women folk, and generally or everyone aware of various issues relating this disease. By women exercising self-examination themselves or performing examination of their own breasts systematically and periodically, and by involving oneself in screening. Screening is a very useful strategy, and I'll be discussing a little more about it in subsequent time. And if detected early and treated properly, majority of breast cancers can be cured. If the disease is detected in stages 1 and 2 and a complete treatment is undertaken, more than 90% women can be cured for life. However, if it is detected in later stage, third stage or fourth stage, unfortunately, a number of women would succumb to the disease. So currently, almost a fifth of all cancers across the globe, they are occurring in India. That's not surprising given our mammoth 1.38 billion population. But the worst part is that the breast cancer incidence has been increasing steadily. It has increased almost threefold in the last 3 decades, and the current incidence is up to 36 breast cancer women out of 1 lakh population in certain cities annually. So, if there's a city with 10 lakh population of women, every year some 360 women would develop breast cancer. That's a large number, a mammoth number. And if you take into consideration our mammoth population, this does pose a huge problem. There are reasons to believe that there is a truly increasing incidence of the disease. It's not just because of better diagnosis or more awareness. There is a true increase in the incidence of the disease. And in the recent year, 2020, we have had uh, more than 2 lakh women, new breast cancer diagnosed in our country. So, in our country, the cumulative lifetime risk of women developing breast cancer is 1 in 29. 1 in 29 Indian women would develop breast cancer during their lifetimes. That's a huge number, huge proportion. Of course, this is much lesser, much smaller compared to, say, women in Scandinavian countries and certain other Western, more developed countries. But nonetheless, it is quite a large number. So, some of you may be inquisitive. What is, after all, breast cancer? Well, each of us, each human body is built up of billions and trillions of cells. These cells are nothing but the building blocks of our body. Each cell is a living being. It takes origin, it is born, it develops, matures, and eventually dies out. There is a program which controls the growth and also controls the death of every cell, as also the breast cells. If for some reason, some genetic or molecular defect, the cells lose this realization of when to stop dividing and when to stop growing and when to die, they will continue to pile up and they can cause a lump. These lumps form tumors. Not all tumors are cancerous, but certain tumors, they develop this uh, uh, capacities or capability to metastasize, to spread to other body parts, and then they can be lethal. So that is what breast cancer is. How can we improve the outcomes of breast cancer? How can we reduce cancer related deaths due to breast cancers? How can we improve the whole scenario? It is by undertaking these 3 steps: early detection, comprehensive treatment, and research. And early detection is the most important one of it. And it again has 3 steps to it: awareness, screening and detection, and early stage diagnosis. And this is primarily what I would be discussing today, because this is what we can do to ourselves. Every woman, every family, every section of the society can partake in awareness and screening programs to detect cancers early. So let's talk about awareness. What do we need to be aware of? Firstly, we have to be aware that breast cancer is a common disease and it can occur to anyone. There's absolutely no woman whom we can say is immune of this disease. Unfortunately, there's nothing we can do to prevent the disease in majority. It will occur in women who are genetically predisposed, or so to say, they are destined to develop this disease. But we can certainly reduce the chances of developing of the disease, and we can definitely reduce the suffering and cancer related deaths because of the disease. We also need to be aware of what are the risk factors according to which we'll be able to make out who are the women who are at a relatively higher risk of developing it. Risk factors are certain factors attached to our body, attached to our lifestyles, which may predispose or which may put a person at certainly higher, a somewhat higher risk of developing a disease. It is in no way a definite predictor of a cancer or a disease becoming apparent at certain stage, but just that if you have these factors attached to you, there would be somewhat higher chances of you developing the disease. We also need to be aware of what are the warning signs, what are the symptoms with which a woman may present, may be diagnosed with breast cancer. And so they need to be aware of these. And we also have to be aware of what is the strategy of screening. How does it help? How does it help in early detection? How can one do breast self-examination? And then finally, in a very short span of time, I would also like to discuss how is breast cancer diagnosed and how is it treated. So let's talk a little bit in details awareness of breast cancer and how it can save lives and save breasts. I talked about risk factors for breast cancer. These can be both internal or personal in nature, or they can be external or environmental. Both are equally important. Is any of you in the audience aware of a family member or somebody whom you've known, a man who developed breast cancer? Perhaps not, but majority of you would be aware of some women in your surroundings or women whom you know who have developed breast cancer. So the female gender by itself is a risk factor. It predisposes a one for from contracting this disease. Again, cancers in general, breast cancer as well, is a disease of aging. As we grow older, the chances that breast cancer can occur, they keep increasing. Usually, we find that the risk is considerable in women more than 40 years age. But unfortunately, even in younger women, 20, say 25 to 40 years age too, can develop breast cancer. If a woman has not given birth to any child or has given birth to her first child after the age of 35, she is at a slightly higher risk of developing breast cancer. There are some girls who start having their menses rather early, say 10 years age, and then there are women who continue to have menses very late in life, say until 55 years age. So the longer the time span of menstrual life of a woman, higher are the chances of breast cancer being developed. This is one risk factor which is well under our control, which is something where we can take action, we can modify it, and that is being overweight, obesity. This is certainly a risk factor. A woman who's not physically active, who's overweight, is at a certainly higher risk of developing breast cancers. There used to be certain types of hormone replacement therapies for postmenopausal osteoporosis, which used to be used, say, 2 decades ago or so. Fortunately, no longer they're used. And similarly, certain kinds of oral contraceptive pills, which used to be used many decades ago, they would increase the risk of breast cancer. Fortunately, we have identified these things and they are not no longer used. If there's one thing that we can do to reduce our breast cancer risk in a definite manner, it is breastfeeding. Women who have never breastfed a child or who have breastfed only one child for less than 6 months of duration, they are at a higher risk of developing breast cancer. And women who have breastfed at least two children for at least 6 months duration, they are protected against breast cancer. They are at a much lower risk of breast cancer. There are certain other lifestyle factors such as use of tobacco in any form, chewing tobacco or smoking or hookah, bidi, canny, any kinds of tobacco usage, use of alcohol, lack of exercise, and excessive consumption of red meats. These also increase the risk of various cancers and diseases, including breast cancers. There are certain protective factors, and these primarily are being physically active, staying close to your ideal body weight, and not being obese, consumption of plenty of green leafy vegetables and fresh fruits, and generally being or following a healthy lifestyle. Uh, there are certain families where number of members develop cancers and breast cancer too. And these are families which have a genetic form of breast cancer. I'm certain many of you have known the story of Angelina Jolie, the famous Hollywood actress. She and her family members, her mother, grandmother, had a gene mutation which predisposed them to developing breast and ovarian cancers. And Angelina Jolie performed on herself, or she underwent a preventive or prophylactic bilateral breast removal and then preventive bilateral ovaries removal by surgery. So that reduced the risk of her developing breast cancer. Unfortunately, just a small proportion, or say about 5% of all breast cancer patients, have some form of identifiable gene mutation which can be actionable, which can be some intervention can be done based on which to reduce the chances or prevent breast cancer developing. So far I have discussed about the risk factors of breast cancer. So switching gear, now let me talk about what is screening of breast cancer. Now, screening is a concept I need all of you to understand very clearly. If I may use a simile, uh, all of us drive some sort of a vehicle, a four-wheeler or two-wheeler, and even when the two-wheeler or this four-wheeler may be driving perfectly well, we still send our vehicle to the garage for a preventive maintenance. The vehicle is checked by the mechanic, and then in case something is found wrong, it is set right even before it manifests. Similarly, a human body may be accumulating some changes, some abnormalities, and yet not be manifest in form of a disease. But if the doctor periodically examines you, say once every year after the age of 40 years, performs the essential tests, they may find certain changes which may either be predictors of a disease, including breast cancer, or they may actually be the starting of a disease. And so, an effective treatment at this stage can provide cure. So in terms of breast cancer, we can screen a woman for breast cancer by doing periodic clinical breast examination. That is to say, a woman would visit her doctor who would just examine the breast by looking at the breast and feeling the breast well in a systematic manner once every year after 40 years age. Women are also advised to undergo mammography. What are mammograms? Mammograms are nothing but a specialized form of X-ray which help us look deep into the breasts. And in case there's a small lesion, a small nodule forming there, we can detect it and cure it before it becomes troublesome. And the third way is self-examination of the breast by the woman herself. And this is indeed the best form of awareness and perhaps also a good way of breast cancer screening. Partaking in these forms of screening programs, one can detect cancers early, and that increases the chances of survival. Let me now discuss stepwise how can a woman examine her own breasts. It is needed to be done systematically once every month. Women who are still menstruating, who have not attained menopause, they should do it mid-cycle. So that is to say then that around 5 to 7 days after the periods have stopped, that is the right time to do it, starting at 20 years age. Why 20 years? This is the age when the girl is mature enough to know what is right for her. And also this is the age when majority of women or girls would have a fully formed or developed breasts. And so it's good idea to start breast examination at this age. A woman would need to examine her own breasts firstly while standing and then later on while lying down. Both breasts need to be first looked at very carefully and then felt by yourself with the flat of your hands. Flat part of the fingers are used to feel the breasts and systematically, completely. The breast extend right from the collarbone above to right up to where the tummy starts below. Similarly, on the side around where your back starts and right to the midriff. So one needs to examine whole of this area. And how does one do it? The left breast is examined using the right hand, and the right breast is examined using the left hand. One first inspects or just looks at the breast to see if there's any change in the size or shape of the breast. Also, to see if there's any area of the skin over the breast which is puckered or discolored, it is darker or reddish, or any other change in color. Also, look at any alteration in the nipples. If the nipples are projecting outwards normally, if they are located in the right position, if they are not pulled out towards the or pulled in inside inwards, and they're not pulled inside, or they're not retracted. These are the things that you would look for. And this is a stepwise guide. As a first step, expose your breast completely in the privacy of your bathroom or your bedroom, and inspect yourself in a mirror. Firstly, look at the shape and size of the breast, symmetry of the breast. Look at the nipples, their shape, their symmetry, and if they're pulled towards any side, or they're puckered, or they're inwardly retracted. Having inspected with the arms by the side, then do this kind of maneuver when you would clasp your hands behind the head and push your head with the hands. And this tautens the pectoral muscles on which the breasts rest. And then again inspect your breast. And finally inspect in this kind of a condition where you are pressing on your hips with the hands. Again, this tautens the pectoral muscles and makes the breast more prominent, and certain kind of changes are better inspected or better appreciated with this maneuver. Having inspected the breast completely, you can then start feeling your breast. As I said earlier, you feel your left breast with the right hand, and the right breast with the left hand, and using the flat of your fingers, as you can see in this picture, and not by pinching the breast between your fingers and the thumb. Uh, you can use various ways, but I feel one good way is to by making concentric circles. You start from around the nipple and keep making larger and larger circles going outwards, and feel the entire breast as well as the armpit. Finally, you squeeze or slightly pinch your nipple to see if there's any discharge from the nipple. And why do you do that? I'll come to those. Having inspected and then felt your own breast while standing, you then lie down. Put a small pillow or a folded towel under the shoulder, and then feel your breast in the way that is shown here. What are you looking for? These are the common symptoms or signs which you are looking for. Any change in the size or shape of the breast, dimpling or puckering of the skin in any area of the breast, feeling a lump or a hard knot or thickening inside the breast or in the armpit. Well, a painless lump is the commonest symptom of breast cancer. Not all, and at the same time, it must be said that lumps in the breast are very, very common. There are a large number of women with some lump in the breast. Not all lumps are cancerous. In fact, majority are not cancerous. The statistics says that only 1 out of 10 lumps that we evaluate in the clinics eventually turns out to be cancerous. So 90% are not cancerous, but to be able to discern which one is cancerous and which is not, or which is an innocuous, harmless one needs some bit of expertise and also undertake some tests. So you cannot presume for yourself that my lump is innocuous and I don't need to take any action. You will have to consult a doctor if in case you feel or you find a lump in your breast. You also would like to see if there's any discharge from the nipple. A woman who's not pregnant, not lactating, or not breastfeeding, not nursing a child, if she finds that she's having a discharge from the nipple, she must consult a doctor, especially if the fluid that is coming out of the nipple is bloody or blood mixed. It can be dangerous. If there's a change in the shape or the form of the nipple, if there's a scaly or itchy sore or a rash which has formed on the nipple which is not going away, this too can be dangerous. Breast pain is again a very common symptom. In fact, there's no woman, no girl who would not have experienced some form of or some degree of breast pain sometime in their lives. But this is in no way a symptom of breast cancer. However, if majority of the women or girls who suffer from breast pain, the pain is cyclical. It comes with the menses or the periods and goes away by itself. But if there's a pain which stays at one spot and doesn't go away, this can be troublesome. And for any of these symptoms, you must consult a doctor. Pulling in of your nipple or inward retraction of the nipple or any other part of the breast skin can be a sign of or a symptom of cancer. If there's any one part of the breast which is feeling rough, thickened, warm, red, or dark, these can also be symptoms of breast cancer. So if you see any of these changes in your breast, you must visit your doctor. The doctor would do a clinical breast examination, or in other words, simply inspect and then feel your breast in a systematic way, the way it is seen here in this picture. And then the doctor may ask you to undergo a mammogram. Mammogram, as I said, is a specialized X-ray where the breast is compressed between two plates, and the one of the plates is an X-ray plate. And using this highly specialized X-ray, we can see into the depth of the breast. Here you can see this is the left breast shadow and this is the right breast shadow. And the white, or rather bright, area that you see is the area of pectoral muscles. Deep within the left breast, there's a lesion, there's a lump, which is tiny and which could not be palpated or could not be felt by the doctor. But it is seen on this mammogram, and this was biopsied and turned out to be cancerous. Ultrasound of the breast is also very useful, very helpful in detecting various diseases, especially in younger women, younger than 35 years age, where women who have dense breasts, where mammogram may not be as effective as useful. In many women, we resort to a biopsy. Biopsy is a process where we take out some tissue piece or some cells from any suspicious area using either performing a surgery or, as we usually do now, using a thick or a thin needle. So without even operating, we get some tissue for the pathologist to examine and tell us whether there's anything dangerous in that lesion, or is it something innocuous or harmless. Okay, so having covered the early detection part, there's some echo. Is there some problem? Is somebody speaking? Is there any question?
I don't know how the echo is coming.
Maybe others can mute their mics if
Yes,
they're not
please.
speaking.
Shivi, can you mute everyone? Yes, please. Thank you.
Okay, so having covered the early detection part and how we can do that, let me quickly apprise you of what comprehensive treatment for breast cancer is all about. Breast cancer is a disease which cannot be treated by one single doctor or one single way of treatment. It requires a whole team of surgeon, a radiation oncologist, a medical oncologist, who are assisted by a radiologist and a pathologist. And it is ideal to have this kind of treatment under one roof where all these specialists are available. And I'm fortunate to be working at SGPGI. We have all these facilities available under one roof. And this is because breast cancer requires to be treated by a combination of surgery, radiation therapy, which is a highly specialized X-ray therapy, chemotherapy, which is nothing but chemicals or drugs which are used for cancer treatment, hormone therapy, and biological therapy. In terms of breast cancer surgery, in majority of patients or women who have early stage cancers and a small tumor, we can we can cure them without removing the whole breast. We can simply remove the tumor and some part around it and cure the disease. However, if the disease is large or there are multiple tumors, or for some other reason, if the disease has spread to the skin, then we have to resort to a procedure what we call as mastectomy, or in simpler words, it is removal of whole of the breast by a surgery. Surgery by itself is very useful or helpful, but to augment the success that we derive from surgery, we use radiation therapy. By irradiating the rest of the breast after removal of the tumor, or irradiating the chest wall after removal of whole of the breast, we irradiate this with X-ray beams and that increases the success of surgery. It reduces the local recurrence drastically. Chemotherapy are highly effective drugs, and usually they're used either before or after surgery and then they are highly effective in preventing the spread of disease to other body parts and so prolonging life. Breast cancer is a disease which is propelled or progresses under influence of the female sex hormone, that is estrogen. So if we can modulate the estrogen levels or its action on body cells, we can arrest the growth or progression of breast cancer. And so hormone therapy is again highly effective in breast cancer patients in about 60 odd percent of all breast cancer patients. And these are simple pills which are used for 5 to 10 years after the primary treatment in form of surgery and radiation and chemotherapy. Similarly, there's a antigen called HER2/neu, which is expressed in the cancer of roughly about one-fifth of all breast cancer patients. If that is so, a highly effective biological therapy in form of Herceptin and certain other drugs is available, and this can also be used and is indeed used to improve the survival rates. So finally, one may ask, why do we bother to why should we bother to diagnose the disease early? What benefit do we derive? And the benefit is that the disease is curable in early stages, and so if it is detected early, it can be cured. And this is not simply a notion, it is backed by solid, robust data from all across the globe. And let me just quickly apprise you of what stages of breast cancer are. If the disease, we can diagnose breast cancer even before it is manifest. This is what we call as stage 0. If a disease is detected at this stage, 100% women diagnosed at this age or this stage would be well and alive 5 years after the diagnosis and with complete treatment. If the disease is diagnosed at a tiny tumor stage where it has not spread to any of the body parts, this is stage 1 disease. And again, 100% of women would be alive and well 5 years after treatment. If, however, the disease has become slightly larger, the tumor is slightly larger but less than 5 centimeters in size, and if at all it has spread to any parts, it is limited to the armpit. This is stage 2 disease, and if patient is treated at this stage, roughly 90% of them would be alive and well 5 years after the treatment. If the disease has involved the skin or the chest wall or extensive lymph nodes in the armpits or elsewhere, this is stage 3 disease. If this treatment is done at this stage, roughly 70% of women would be alive and well 5 years after treatment. If, however, the disease has involved, it has spread to the liver, to the lungs, to brain, to bones, this is fourth stage of disease. If treatment is done at this stage, unfortunately, no more than 20% women would be alive at 5 years after treatment. Majority, that is close to 80%, would die of this disease within 5 years. So I think this data is compelling enough to say that disease is curable in early stages, and it makes sense to do everything possible to detect the disease early and cure it well in advance. So whatever I have discussed today, awareness, early detection, screening, and treatment, there are a lot of other information available from various sources. Our SGPGI Breast Health Program website is another resource which you can use, and you can visit this website sgpgibreasthealth.org.in, and you'll find a number of questions answered here and quite a few very useful tips and tricks for detecting cancers early. So if I'm certain there would be many questions, many comments, and I'll be happy to address all of them. And in fact, I would be very happy if everyone who's attending this webinar comes out with their myths or queries clearly aloud so that we can address all of them. Thank you very much.
Thank you, thank you, thank you, Dr. Agarwal. That was a very informative session, and I feel very empowered that this condition can be detected earlier, and it's in my hand to detect it and also early detection means cure. So I feel very empowered. Thank you very much for this session. I'm sure there are questions. I would invite everybody to please go ahead and ask. A couple of questions that I have. Um, are there any side effects to mammography if we are doing an annual mammogram? What are the side effects, if any?
Okay, great question. Yeah, fortunately, there are no side effects of mammography whatsoever. It does come with a bit of inconvenience. After all, a woman would have to visit a hospital or a diagnostic center. It is not something which can be done at home. And then, while doing this examination or the test, the breasts are compressed between two plates. So it does cause a bit of discomfort. It doesn't uh, cause any disease by itself. It doesn't increase the chances of cancer or any other disease by itself.
Okay, wonderful. Another question that comes to my mind is for the low income group people like our maids and our house helps. Um, many of I don't know how much it costs to do a mammography, but are there any government hospitals where there are some detection centers or checkup centers where one could visit?
Great question again. And so let me start or begin my answer by saying that let's not attach too much importance to mammography itself. Mammography by itself doesn't prevent, and it's not the only way of detecting breast cancer early. In fact, breast self examination and examination by a doctor are quite good enough to detect cancers in stage 2 for sure, and in many women in stage 1. And these are both, as I expressed earlier, these are the curable stages of breast cancer. So even if we are living in a or we are not having a facility of mammography close enough to our homes, it doesn't mean that we cannot detect breast cancer early. So what is important is all government hospitals, all district hospitals for sure, and many sub-district hospitals have surgeons trained for to do breast examination. So women can certainly visit these hospitals and have their breast checkup done. If there's a need for imaging, breast ultrasound can be done, and almost every government hospital, every district hospital has ultrasonography facility available, and many also have mammograms. Mammography is certainly available in all medical colleges, almost all medical colleges. In Lucknow, there would be something like 100 mammography setups. Not all of them would be ideal quality setups, but at least 20 excellent quality mammography centers are there, half of them in government sector, half in private sector. So in larger cities, even in not so large cities and tier 2 cities, there is there are good enough facilities for mammography. Okay, you also asked what is the cost. Well, in
Yes.
government sector, like SGPGI is a paid hospital, though government hospital, where nothing is charged in terms of professional fees, but the government charges a heavily subsidized cost for everything. At SGPGI, the cost of mammography is 720 rupees or so. In KGMU and RML Institute and perhaps so many other government institutions and hospitals, it would be cheaper or even maybe free. But in private sector, the cost may vary. I'm not aware how much exactly it would be, but there are a number of low cost alternatives or low cost options available for
Mhm.
mammography.
Okay, wonderful, wonderful. Josna has a couple of questions. She's asking, how about rural India? I mean, what are the options there in rural India? I mean, people don't have access to such hospitals. So how about that?
Yeah. So a few things about a few facts about breast cancer in rural India. Well, fortunately, breast cancer incidence is somewhat lower in rural women as compared to urban women. But rural women can get the initial help or with in form of examination of their breast and advice for biopsy and imaging at their local community health centers, or by visiting their sub-district or a district hospital, whichever is the closest to their homes. Of course, cancer treatment is highly specialized, may not be available at their doorstep, and they may have to travel to a relatively large city, whichever closest is there to their home for this treatment. Fortunately, the essential or basic treatment of breast cancer is available almost all hospitals now. The quality may vary, but indeed some basic treatment is available. In terms of screening of urban and rural women, the government of India has initiated a nationwide program for screening of 5 important diseases. These include 3 cancers too, or rather 6 important diseases. These include 3 cancers in form of breast, cervical, and oral cavity cancer. Because these are 3 most prevalent, most common cancers, and almost 100 districts have already rolled out this program across the country. Besides, number of state governments have also started such screening programs and early detection programs.
Okay. Wow, good. Um, the other question that comes from Anjali, she says, fibroadenoma, can that turn malignant?
A short answer to that question is no. Fibroadenoma are benign tumors. These are tumors nonetheless, but they are not. They do not have the capability to spread to other body parts, and so they are not cancerous. And if they are left untreated, as we advise many girls, many women with small fibroadenomas, they simply lie there. They have a possibility of increasing in size or progressing in size, and in certain girls and women, they can cause pain and some other symptoms, but they would not turn cancerous. But before we label a lump as fibroadenoma, which is totally innocuous, which doesn't has the capability of turning cancerous, we must do appropriate evaluation, and this may include biopsy too. Not an operative biopsy, but a core needle biopsy.
Iram says, can chronic sinusitis can be associated as a sign of cancer?
Chronic sinusitis, certainly not. It is in no way related to breast cancer.
Okay. Doctor, how about breast reconstruction? I mean, after the surgery, what are the options available for that, and especially for the low income group, if there is any?
Well, if I mean, as a whole, I would say women in India do not have access to breast reconstruction if they cannot pay for it by themselves. There are just a handful of government hospitals or centers where this facility is available free of charge or at a very low cost. Even at SGPGI, a woman who requires breast reconstruction pays a subsidized cost for the procedure, and quite a substantial cost for the in case an implant is used. Breast reconstruction is done in a major way in 2 different ways. One is by using a prosthesis or an artificial breast, or by using a body tissue itself, or a muscle, more specifically. So reconstruction using a muscle involves a little bit of a long duration surgery, and so it costs a bit. And when one uses a prosthetic breast, an artificial breast, the cost of the artificial breast itself ranges between 25 and 50,000 rupees per breast. So that is the kind of cost the patient has to bear, even in government hospitals.
Okay. Are there any NGOs, doctor, that are working in this field that we could reach out to?
Certainly, there are a number of them. There are a number of NGOs, including the Indian Cancer Society, and I would not like to name just a few of them. There are any number of them. I have had some very good experience working with some of them, and at the same time, have had not so good experience with some others. That is the reason I would refrain from saying or advocating one or just a few of them.
Okay. Anjali also has another question. She says, is there any association between cervix cancer and breast cancer?
Fortunately not. Cervical cancer is a disease primarily linked to a form of a viral infection, human papilloma virus. And the probability of cervical cancer is higher in women who have poor menstrual hygiene, who have had infection after childbirth, and generally have poor vaginal hygiene as such. And with passing years, the standards of menstrual and vaginal hygiene in our country has improved, and with increasing proportion of institutional deliveries and use of sterile material for deliveries and menstrual pads, this possibility has gone down. It is in no way linked to breast cancer. There are, however, linkages between breast and ovarian cancer. There are certain genetic disorders which predispose to both. Just as I discussed about the story of Angelina Jolie, she had that kind of defect, genetic defect, which predisposed her to both of those.
Okay. Okay. Um, Iram wants to know what material is the artificial breast made of? Is it
Okay.
silicone?
Yes, primarily silicone or silicate material, but then those material are used to make kind of balloons which are filled with either saline or silicone itself, or a combination of the two. And then there are a number of modifications which have been made to make them more make them safer, or make them more natural feeling, feeling more natural. So those are the materials. Primarily it is silicone.
Okay. The fibroids, we see fibroids increasingly prevalent in uterus. Does it have any relationship or association to breast cancer?
No, fibroids of the uterine fibroids are they can be troublesome, both because of any dysfunctional bleeding or the size itself, or they
Mhm.
may turn cancerous later on their self, but they would not cause breast cancer. They have no linkage to breast cancer.
Okay. Okay. I think we have had questions, and there are. I hope we've answered everybody's concern and questions. If there is anything that any of you would like to ask Dr. Agarwal, please can you raise your hand or go ahead and ask? All right, I think we've covered everything for now, Dr. Agarwal, and I really want to thank you for your immense valuable knowledge that you've shared with us today. And it is, I'm sure it's going to go a long way in helping all of us that are present here. And we will be able to spread the message further to other women, friends, and colleagues. So if we need to reach out to you, we will go to SGPGIMS, and should we write to you somewhere or?
Well, you may email me. I'll put my email ID in the chat box right away. But that's the best way to reach out to me.
No.
Fortunately, breast cancer is not a condition which requires attention within minutes. It's not an medical emergency. And if there's anyone whom I can help with any concerns, you can very well email it to me.
Thank you so much. That's very, very generous of you. Thank you very much for taking out time today, and you've spent an hour with us. And I know that life would be very busy with at the hospital. And thank you very much. Okay, one last question, Dr. Anjali just said. Long time hormonal imbalance, is that also a cause for breast cancer?
Well, it depends which hormone or imbalance of which of the hormones are you talking about.
Okay, it
Our
needs
body
further
has,
investigation.
yes, our body has any number of hormones. So commonly women are confused with thyroid hormone imbalance or lack of adequate thyroid hormone levels, hypothyroidism. It has very little or if any relationship with breast health, and certainly has no relation with breast cancer occurrence. But there are certain kinds of hormonal imbalances. If there is a estrogenic any reason, a long-term excess amount of estrogen that may have, I'm using the word may, PCOS, as I see Anjali has put in now, again, in a major way, it is not known to cause or predispose to breast cancer. Polycystic ovarian syndrome or polycystic ovarian disease has no direct relationship with breast cancer. However, there are some treatments, some form of treatment used for some of these women suffering from PCOD, which may predispose a woman to develop breast cancer. And as a result, all that is needed is women should be more aware. They should be more alert about any changes in their breast. They must have breast examination done annually if they are on these treatments.
Okay, great, wonderful. Thank you everyone for taking out time and being here and listening to Dr. Agarwal today. And I'm sure you've also gained a lot of knowledge, and thank you for all your questions as well. Thank you, Dr. Agarwal, once again. I am very blessed to be a part of this session today, and I feel really empowered. Uh, Josna also wants to thank you personally. She's on the road, so maybe her voice is not clear, but uh, much gratitude, much gratitude. Thank you very much.
It's been a pleasure. Thank you so much. Okay, goodbye.
Bye-bye.